Hi, I'm Michael Ruger. I'm the managing partner at Greenbush Financial Group, and today we're going to be talking about Medicare. So as you approach age 65, or even if you work past age 65 and you're about to retire, you're going to have to make some really important decisions about your health care in your retirement years. And a lot of it is surrounded around your Medicare decisions. And a lot of these decisions you're going to make, you get one shot at depending on the state you're in. So if you make these decisions and you make the wrong ones, it could end up costing you tens of thousands, if not hundreds of thousands of dollars in retirement in the form of missing coverage where you have to come out of pocket for a lot of money that you didn't expect. We've actually seen people have over coverage where they're paying for too much insurance and they're not really using it. And also we've seen people miss deadlines, and there's lots of penalties associated with missing deadlines that are lifetime penalties. So really this video is to make you aware, broad stroke, as far as how Medicare Part A, B, C, D work and Medigap insurance policies. So at the most basic level, what is Medicare? Well, Medicare is the government-run program that essentially provides your health insurance benefits once you reach age 65 or retire past age 65. And it's surprising to some people that Medicare is actually run by the Social Security Administration. So when you go to call to sign up for benefits or set up your consult meeting, it's actually with your Social Security office. There aren't special Medicare offices that handle this. And you've paid into the system throughout your working career. A little over 1% of all your paychecks get paid into Medicare, and that essentially is what reserves your benefit when you get to filing past age 65. Now, while there's different pieces of Medicare, A, B, C, D, A and B are the core pieces of Medicare that provide most of your benefits. And A and B together is what's called original Medicare. And you're going to see that term over and over again as you research your Medicare options, because A is really your hospitalization benefits, B are really your doctor's visits, medical equipment. So together, those two really provide your core for your health insurance coverage in retirement. So let's start with Medicare Part A. Medicare Part A covers your inpatient health services, which means inpatient into a hospital, inpatient into a nursing home, but that's limited. So Medicare Part A, I want to be very clear, does not cover all of your nursing home needs. It covers a specific number of days, and then from there you're on your own. It also covers some hospice services and some limited home health services. Now, if you worked and paid into Medicare, or your spouse worked and paid into Medicare for at least 10 years, there's no monthly premium payment that you make when you enroll in Medicare Part A. But that does not necessarily mean it's free. Even though there's no monthly premium for being in Part A, there are co-payments, deductibles, co-insurance, and other pieces associated with Part A that actually cost you out of pocket if you ever went into the hospital. Before we get into the details of those costs, I first want to just do a quick review of some basic terminology. So we all are pretty familiar with co-pays if we've had health insurance. So you go see the doctor, you have a $25 co-pay for your regular doctors, maybe $50 for a specialist. Those are considered co-pays. There's also deductibles. Certain pieces of Medicare have deductibles, like for example, if you have a $1,000 deductible associated with Part A, that means you have to pay out of pocket the first $1,000 before your health coverage begins. There's also co-insurance, which sometimes you'll see things that have a 20% co-insurance. And what that means is whatever the cost is, that percentage of the co-insurance you're on the hook for. So if there's a 20% co-insurance and I get a $10,000 medical bill, I have to pay $2,000 of that because there's a 20% co-insurance. And then the last piece is the maximum out of pocket. And the maximum out of pocket is the amount that I have to pay personally in a calendar year before the health insurance covers me for everything. So you'll see some things that say, well, there's a maximum out of pocket of $5,000, which means I have to continue to pay co-pays, co-insurance, deductibles until I hit that, let's say $5,000 per year. Once I'm out of pocket $5,000 per year, I'm covered for the rest of that calendar year, and then it resets at the beginning of the next year. And that maximum out of pocket is very important. With that, let's look at the breakdown of the 2019 costs associated with Medicare Part A. So take a look at this. This is kind of the breakout that you'll see for Part A, hospital, inpatient, deductibles, and coinsurance. So if you see at the top of the chart, so there's a deductible associated with Part A. So you basically pay the first $1,364 in 2019 before you get to covering anything from a health insurance side on inpatient health services. And this amount changes each year. Medicare will update this, but for 19 it was about $1,300. Then below that, you will see some coinsurance amounts that essentially for your hospital stays, for the first 1 to 60 days, there's no additional coinsurance, but if you have longer hospital days cumulative throughout the year, you see the 61 through 90 days, then you have to start paying $341 per day that you're in the hospital, and then it goes up from there. So you can see that even though there's no monthly premium associated with Medicare Part A, there are some substantial costs that you have to be aware of associated with your inpatient hospital coverage. Now let's look at Medicare Part B. So Medicare Part B covers all your outpatient health services. This includes your doctor's visits, your lab work, any preventative care, any medical equipment, specialist visits. So really Medicare Part B for most people covers the bulk of their health insurance needs throughout the year outside of hospitalization. Now, you might be shocked to find out that Part B can even come into play when you're in the hospital because there's doctor services being performed while you're at the hospital as well, so keep that in mind. Now, unlike Medicare Part A that we just talked about that doesn't carry a monthly premium, Medicare Part B does require a monthly premium to be paid once you're enrolled. And in 2019, most people will pay $135.50 per month each person once they're enrolled in Medicare Part B. However, you could possibly have to pay more than that if your income is at certain thresholds. And if you look at this table, this shows you where those thresholds are. So if you look, you can see if you're an individual filer, then if you're under $85,000 in taxable income, or if you're a married joint filer with your income under $170,000, you're just going to pay that $135.50 per month. Once you start to get above those thresholds, you will see that Medicare starts increasing your Part B monthly premiums, and you're just required to pay more. So here's the tricky thing regarding the income piece for Medicare Part B. They actually look back 2 years to verify what your income is going to be for the upcoming year. So for example, if I'm going to be covered in 2020, Medicare is going to look at my 2018 income to determine, do I have to pay the higher amount for Medicare Part B? And the problem with that is, if I'm retiring in 2020, maybe I'm retiring at the beginning of the year, I'm not really going to have much income for the year, but they're going to look back 2 years for when I was working and say, hey, maybe you're up over that threshold and we're going to charge you more. So there's a fix for that. So when you almost have to anticipate that they're going to look at 18 and they're going to try and charge you the higher amount, really when you go to apply for your Medicare Part B, you have to show them that in this year I am not anticipated to make what I was making in 2018. And what you usually show them is a letter from your employer verifying that you retired on a specific date. You might show them your last paycheck. And there's also a formal form called an SSA 44 form, which shows you've had a life-changing event, and that's why you're applying for the premiums to be based on your anticipated income for the year that you apply. And this is what that form looks like. So how do you pay your monthly premiums for Part B? It's actually fairly easy. They just pretty much take those monthly premiums directly out of either your Social Security benefit that you're receiving or your railroad retirement benefits. If for some reason you enroll in Part B and you're not receiving your Social Security or railroad benefits yet, they will invoice you quarterly for those premiums and you'll just pay them by check. Now, if you are receiving Social Security benefits or railroad benefits prior to age 65, they are automatically going to enroll you in Medicare at your 65th birthday, and those premiums will immediately start being deducted from either your Social Security or railroad benefit. So if you don't want Medicare Part B and you're receiving Social Security and railroad benefits prior to age 65, you have to tell them, don't take the Part B premium, and you have to reach out to them to do that. Otherwise, the deductions are automatically going to happen. So now let's look at the cost structure of Medicare Part B, because in addition to your monthly premiums you have to pay, there's also deductibles and co-insurance associated with your Part B coverage, which is completely separate from your Part A. So in 2019, your deductible for Part B is just $185, but that's what you have to pay out of pocket before you actually get to the insurance piece. But the biggest problematic piece of Medicare Part B is there's a 20% co-insurance on all your coverage, which means, again, any costs you incur, doctor's visits, lab visits, medical equipment, if they deliver you a bill, you're on the hook for 20% of that cost. And if you've ever looked at those medical bills that you got while you were working, they're huge. They're usually big. But now with just Medicare Part A, Medicare Part B by itself, you could have some astronomical health insurance bills in retirement. So how do people manage this? And the other big issue, in addition to that 20% co-insurance with Part B, is Medicare Part A and B have no maximum out-of-pocket limit, which means you have to keep paying and paying and paying throughout the year without any cap on your amount before Medicare says, hey, we've got the rest. So the way people manage this is by getting either a Medicare Advantage plan or a Medicare Supplemental Plan. So this is where we enter really the other three pieces of Medicare. So we talked about Medicare Part A and B, hospitalization, kind of doctor services. But then Medicare Part C is your Medicare Advantage plans. Medicare Part D are your prescription drug plans. And then there's also Medicare Supplemental Plans, also known as Medigap. So really all those pieces together can make up potentially your Medicare solution. Now, before I get into what each one does, I think it's important to identify who provides what, because it can get a little foggy. So Medicare Part A and B, your original Medicare, that's provided by the US government. So those are government benefits to you. Medicare Part C, which are technically Medicare Advantage plans, those are provided by private health insurance companies. Medicare Part D, which are prescription drug plans, those are also provided by private health insurance companies. And Medigap plans or Medicare Supplemental Plans, those are also provided by private insurance companies. So private insurance companies do have a role usually in your overall Medicare coverage. So this is where we get to the most important decision you're going to make around your Medicare coverage. Do you go with a Medicare Advantage plan, which is kind of Medicare Part C, or do you go with a Medicare Supplemental Plan, which is called Medigap, and a Medicare Part D plan for your prescription drug? It's one or the other. They don't work together. So Medicare Advantage plan, Medicare Supplemental, and a Part D plan. And unfortunately, most people have no idea what the difference is between the two. And we've even talked to clients that said, hey, I've got Medicare, a Medigap plan, and we look at their card and we say, no, you don't. You actually have a Medicare Advantage plan. And they could not be more different. And then this is where the flaws come into play, that there could be additional costs if you make the wrong decision for yourself. The one challenge that you will find when making this decision is, unfortunately, a lot of insurance companies and a lot of Medicare insurance agents will push you towards the Medicare Advantage plans because it pays them a lot more, both to the insurance company and the agent. But a lot of times it's not in your best interest to have a Medicare Advantage plan. It's better to have a Medicare Supplemental. But sometimes these insurance companies, they don't even offer a Medicare Supplemental, so they're going to talk to you about Medicare Advantage all day long. So you really have to be well educated as to the difference between the two, which we will go over. So let's start with Medicare Advantage plans. Now, the first and most important point I'm going to make, and this should be the main takeaway from this video, Medicare Advantage plans are not the same as Medicare Supplemental Plans. Medicare Advantage plans replace your Medicare coverage. They do not supplement it. Remember, I mentioned that Medicare Part A and B? If you go into a Medicare Advantage plan, Medicare is essentially selling you to the insurance company. When you go in for doctor's visits, you no longer have a Medicare card to show them. That health insurance company that you're getting your Medicare Advantage plan through, they are your full coverage and they dictate your health insurance world. So I just want to be very clear that some people think Medicare Advantage plans are supplementing their Medicare. They're not. It's actually replacing Medicare entirely, and you're subject to the terms of that plan, because Medicare Advantage plans, their minimum requirement is they have to cover all the services that Medicare Part A and B cover, but not necessarily at the same cost structure. So they could charge you more coinsurance, more copays, more deductibles. They basically have to just create what Medicare considers an actuarial equivalent, which is a fancy way that says when they look at your original Medicare A and B coverage, they put a dollar on that and say the dollar value of this Medicare Advantage plan, when you add up all the benefits, has to at least equal the dollar value of A and B, but they can structure it how they want. And all these plans differ based on the different insurance companies. Different insurance companies will have 5+ different flavors of these Medicare Advantage plans. So you really have to understand what you're getting, and at a minimum know the minimum baseline for these plans is just the equivalent of A and B. You're not getting anything more. There are some Advantage plans that do offer more, and you can pay an additional monthly premium for that, but you just have to really understand that actuarial equivalent term. So knowing that, why would anyone ever choose a Medicare Advantage plan? Well, there's 3 reasons why some people do choose to go the Medicare Advantage route. The first is there are maximum out-of-pockets associated with these policies. Remember when I said Medicare Part A and B, there's no maximum out-of-pocket? If you have coinsurance and everything, you could be paying out-of-pocket all year long with no limit. These policies do offer protection against that. So even though you're out of the Medicare system, they might say, well, once you hit $6,000 per year in out-of-pocket costs, we will cover the rest. Or if it's an out-of-network at $10,000, we will cover the rest. Because these Advantage plans are set up similar to the working world of these HMOs where you have to stay within the network, and PPOs where you can go in-network or out-of-network. That's how these Advantage plans are set up. The other thing these plans provide is prescription drug coverage. So Medicare Part A and B, there's no prescription drug coverage, which is very expensive. These Medicare Advantage plans, if you select a plan, it has a prescription drug coverage wrapped into it. So there will be some for generic drugs, specialty drugs. They usually have different tiers and different cost structures. So there is some drug coverage involved, which helps. And then the last piece is, usually when you compare the monthly premiums for Medicare Advantage plans versus Medicare Supplemental plans, usually Medicare Advantage, the monthly premiums are lower because you're kind of getting less coverage, because the supplemental plans, you're keeping your A and B and they're putting that on top to fill in the gaps, where Medicare Advantage plans, again, are completely replacing. So a lot of people say from a budget standpoint, the supplemental plans just are not affordable to me. The Advantage plan is better than having nothing at all, so I'm just going to go the Advantage route. So now let's look at Medicare Supplemental Plans, also called Medigap Plans. So with Medicare Supplemental Plans, you keep your Medicare Part A and B, and the supplemental plan is laid on top of it with also a Part D drug plan. So as A and B doesn't provide any prescription drugs, you get your Medicare Part D plan, which gives you all your prescription drug coverage, and then your Medigap plan sits on top of it for a monthly premium. Now I'm going to show you this chart. So these are all standardized plans. So you're going to see different letters after each type of plan, like an A, a G, an N, an F. So the important thing to remember is these are standardized, which means regardless of what insurance company you go to, it's the same exact benefit for these type of plans. So let's look at the chart. So when you look at this chart of all these A, B, F, G, all the way down to N's, what you'll see is there's different coverage. So if we look at the Part G plan, which is really the most comprehensive coverage plan, so see all these 100% in those columns? That means even though Medicare Part A had a deductible, your Medigap plan covers 100% of that deductible, so it pays that. So really, if you have one of these Part G plans, for the most part, except for your Medicare Part B deductible, it almost covers all of your costs. So you just pay your monthly premium each month and you don't have to worry about anything else. Now there's different variations saying if you don't go to the highest coverage plan, then there's definitely plans in between. The most popular is Plan G, and Plan N. Plan F used to be very popular, but that's going away for any new enrollees as of 2020. Some important notes about these standardized plans. So even though, let's say, a Medigap Plan G is the same regardless of whether you go to United Health or Humana or CDPHP, even though the benefit structure is exactly the same, the cost may be different. So that's why you really have to shop these plans around, because you're getting the same exact benefits, but one insurance carrier could have it for, let's say, $200 a month, and the next insurance carrier could have it for $250 for the same exact benefits. So you really got to kind of shop things around or work with a broker to shop those around, so you're making sure you're getting the best policy for the best cost. Another important note is not all insurance companies, as I mentioned before, offer Medicare Supplemental Plans or a specific type of plan. They might offer a Plan N, but not necessarily a Plan G. Or they might not offer Medicare Supplemental at all, and all they offer is Medicare Advantage. So if you go directly to the insurance company, they might not even present supplemental or all the plans as an option to you. So you really have to deal, that's why there's advantages to dealing with an independent that can really represent both to you equally. I want to talk briefly about Medicare Part D plans. So again, if you go the Medicare Supplemental Insurance route, you are going to need to add a Plan D to that, which covers your prescription drug coverage. Now, there are some advantages to going to the drug coverage route of Part D versus getting looped in to the Medicare Advantage, which has everything prepackaged. Is in the Medicare Advantage plans, your drug plan is packaged into your benefits, which means you can't really select a plan that's custom for the prescription drugs you're taking. Or if you go to the Part D side, it's a standalone drug plan, so you can really say, here are the prescription drugs I'm on, which plan is going to give me the best coverage for the best cost, and you have some flexibility each year to change that. So it can offer some benefits. So usually what you have is you have your A and B, you pay your monthly premium for the Medicare supplement, and then you have a separate monthly premium for your Part D drug coverage. Now, this was a 30,000 foot view of Medicare A, B, C, D, and Medigap policies. There's obviously a lot more important decisions that you have to make, such as when you have to enroll, how you enroll, what if you work past age 65, and with all these rules, believe me, there's always exceptions to the rules when we're kind of consulting with clients. So we're going to be producing other video content for that, so just look out for that. But the one thing I can't stress enough is these are health decisions that you're making when you're making these Medicare elections, and health decisions are individual to you. So too often we see people say, well, I went this because my neighbor did this, or my coworker did this, or my family member did this. Like, a lot of times that can lead you down the wrong path. We've had clients where we've had two spouses. One was really healthy, so we said, we can go the Advantage route and save you a bunch of costs. Where the other one didn't have good health, so we had to go the supplemental route because we would have had astronomical health costs. So really it pays to really sit down with someone who's going to explain the difference so you can understand what's the best move for you. If you have any questions on these policies, absolutely feel free to reach out to us at moneysmartboard.com. Thank you very much.